Hi everyone. Today in this video we are going to discuss about Fentermina. What is this drug Fentermina? This drug is classified as anorexiant. These are the category of drugs which are going to reduce the appetite. That's why Fentermina is used in the treatment of exogenous obesity. So this is the obesity due to the excessive intake of food, where the enhanced appetite can be controlled by Fentermina. This drug is actually sympathomimetic, which is going to increase the sympathetic activity. And structurally, Fentermina is related to amphetamine, which is a CNS stimulant as well as sympathomimetic. This amphetamine is classified as indirectly acting sympathomimetic. So Fentermina also indirectly increases the sympathetic activity. The name of the drug gives some structural information. The suffix termine indicates this is having a tertiary amine group, and the prefix fen indicates it is having the phenyl group. So Fentermina is a phenyl group containing tertiary amine derivative, which is structurally related to amphetamine. And this drug can reduce the appetite. That's why it is classified as anorexiant. And particularly this drug can be combined with other drugs such as topiramate, which is an anti-epileptic. But this combination can also be used to control the appetite in order to manage obesity in the patients. So Fentermina is used in the patients with body mass index greater than 30 kg per square meter. So this BMI can be measured as a ratio of weight in kg to the height in square meter. So when this BMI is greater than or equal to 30 kg per square meter, it indicates overweight. In such conditions, Fentermina can be used to control the appetite. But in the patients with any risk factors such as hyperglycemia resulting in the diabetes or any controlled hypertension, increased levels of lipids resulting in hyperlipidemia, in all such conditions when the BMI is greater than or equal to 27 kg per square meter, again the patient may have more risk for cardiovascular complications. So in those patients again Fentermina can be used. Now let us see the chemical nature of this drug. So this is the structure of Fentermina, and here we can clearly observe a tertiary amine group. We have to select the longest chain. So this is the longest chain. Let us give the numbering. So this is 1, 2 and 3. So amine group is present at the second position, and this chain is nothing but propyl chain. So the suffix of the name is nothing but propane 2-amine. Now to this propane 2-amine at the first position phenyl group is present. So 1-phenyl, and second position methyl group is present. So 1-phenyl 2-methyl propane 2-amine is nothing but Fentermina. Now let us see how this drug acts. Even the exact mechanism is not known. At the hypothalamus, sympathetic system is playing an important role in controlling the appetite. So the sympathetic neurons coming from the hypothalamus will store norepinephrine, and at the postsynaptic neurons, norepinephrine receptors are present such as beta-adrenergic receptors. Now when a stimuli reaches to the presynaptic neurons, the calcium can enter into the presynaptic neurons, resulting in calcium-mediated exocytosis, where the norepinephrine can be released and it can act on postsynaptic receptors. This produces an excitation in the postsynaptic neurons, and this signal is going to be transmitted to the colon, where the appetite is going to be controlled. But the action of norepinephrine on control of appetite depends on how much time it is present within the synaptic cleft. So the norepinephrine can be reuptaken into the nerve terminal by norepinephrine transporter, which is expressed on the presynaptic neurons. Now the released norepinephrine can be taken into the nerve terminals through this transporter, which reduces its action. So now this Fentermina can increase the sympathetic activity. This can enter into the presynaptic neurons through this norepinephrine transporter, where it can act on the synaptic vesicles. By displacing the norepinephrine from storage vesicles, this norepinephrine can be leaked out of the membrane through the same transporter. In this way, Fentermina can increase the release of norepinephrine into the synaptic cleft. Now because of more availability of norepinephrine, it increases sympathetic stimulation, resulting in increased control of appetite. So this is one possible mechanism of Fentermina, how it can control the appetite. but this drug can also control other mediators like neuropeptide Y, by which it again controls the appetite. What are the precautions? One of the important precautions of phentermine is that when it is given with alcohol, it can increase the sedation in the patients. So that's why in the patients who are working with machinery or driving with vehicles, this phentermine should be carefully given, and particularly when it is combined with alcohol, it can increase the sedation in the patients. Similarly, phentermine being a sympathomimetic, it can increase the sympathetic activity, so it can increase the blood pressure resulting in the hypertension in the patients. So care should be taken in the patients who are already having elevated blood pressure, because this drug further increase the blood pressure resulting in the hypertension in the patients. Similarly, when this drug is combined with other drugs such as fenfluramine, dexfenfluramine, which is a dextroisomer of fenfluramine, it can increase one of the condition, valvulopathy. It can damage the heart valves, particularly it can affect mitral valve, aortic valve, even it can affect tricuspid valves, so that the pumping efficiency of heart is going to be reduced. So this combination should be carefully given the patients with any pre-existing cardiovascular disorders. Similarly, this combination can also affect on the lungs, where it can increase the blood pressure resulting in primary pulmonary hypertension, PPH. So because of elevated blood pressure, it can produce few of the symptoms such as dyspnea, difficulty in breathing, syncope, fainting, and even it can affect the heart resulting in the angina, and it can also increase the edema in the patients. So all these are observed because of pulmonary hypertension produced by phentermine, particularly when it is combined with drugs such as fenfluramine and dexfenfluramine. What are the side effects? The important side effect of phentermine is on the blood pressure, so it can increase the blood pressure resulting in the hypertension, and it can also produce some palpitations, awareness of heartbeat, tachycardia, increased heart rate. It can produce some central side effects such as dizziness, some insomnia, lack of sleep. That's why this drug should not be given after the evening, because it produces some insomnia in the patients. So this drug is preferred to take during the morning before the breakfast in order to reduce any insomnia in the patients. And it can also produce some euphoria, which results in some addiction. Other side effects include dry mouth, headache, constipation, and urticaria can be observed with this phentermine. How it is given? This drug is available as tablet as well as capsule. It is available at 3 strengths such as 15 mg, 30 mg, and 37.5 mg. So here phentermine is present as phentermine hydrochloride, which is not equivalent to phentermine. The 15 mg of phentermine hydrochloride is equivalent to 12 mg of plain phentermine. Similarly, 30 mg of salt is equivalent to 24 mg of the base, and 37.5 mg is equivalent to 30 mg of phentermine. But always this drug is available as a hydrochloride form. So it is available in 3 strengths, 15 mg, 30 mg and 37.5 mg. The dose of the drug should be given at lowest dose possible, and it is individualized based on the patient. Generally, the initial dose is started at 37.5 mg of phentermine hydrochloride. Now, this 37.5 mg of phentermine hydrochloride is equivalent to 30 mg of plain phentermine. So, the initial dose is started at 37.5 mg, but the dose may also be given as a half dose in the patients with any risk factors such as any renal dysfunction or hepatic dysfunction. And this drug should be given before the breakfast, particularly 1 or 2 hours before the breakfast. It should be taken in order to avoid any gastrointestinal side effects or any insomnia developed in the patients. So that's about this drug phentermine. Phentermine is a anorexiant which reduces the appetite. That's why it is given to the patients for the management of obesity, where the body mass index is greater than or equal to 30 kg per square meter. But in the patients with any risk factors such as hyperglycemia, hypertension and hyperlipidemia, even the body mass index is greater than 27 kg per square meter, this drug can be prescribed. Generally, phentermine is combined with other drugs such as topiramate, which is an anti-epileptic agent which again controls the appetite. Therefore, it is used in the management of obesity. Being a sympathomimetic, this drug can increase the blood pressure in the patients, and it can also produce some euphoria, insomnia. That's why this drug should not be given after the evening in order to reduce any insomnia in the patients. And this drug is available as a salt form, phentermine hydrochloride, at 3 strengths, 15 mg, 30 mg and 37.5 mg. The 37.5 mg is equal to 30 mg of plain phentermine. In many of the patients, it is initiated at 37.5 mg dose of its salt form. But in some of the patients, the dose can be reduced to half based on the patient conditions. And this drug should be preferably given before the breakfast, particularly 1 or 2 hours before the breakfast. This drug should be taken. So that's about this drug, phentermine. Hope you have enjoyed this video. If you like this video, please subscribe to our channel, share this video with your friends, post your comments in the comment box. Thank you for watching this video.